Next on Call, sports, exercise, and injuries. How to avoid pain and stay healthy.
Funding for this program is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Television.
and by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, the Brookings Health System, Regional Health, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
There's the valve.
And which was healthier, the yogurt and the bagel?
All right, I'm going to start by measuring the size of it.
You could also add grilled chicken to this recipe.
Blow hard! Blow, blow, blow! Keep pushing.
And try to just your head.
Pull red handle to open bag.
Okay, stand by. We gotta go. Hello and welcome to On Call. I'm Tammy Watson. We all know that exercise is good for us, but exercise can lead to various types of injury. Sprains, strains, fractures, and worse can be the result when we overdo things. And it doesn't matter if you're a standout high school sports star or a weekend warrior that likes to get in and head out to the golf course when the weather warms up. Tonight we're going to talk about this, sports, exercise, and injuries. Joining me in the studio are Dr. Jonathan Blake, Dr. Judith Peterson, and the On-Call medical editor, Dr. Rick Holm. They're ready to answer your questions about sports, exercise, and injuries, and the phone number for you to call is 1-888-DOCTOR-ON-CALL. Again, that's 1-888-376-6225. And helping answer the phones tonight are volunteers from the South Dakota State University Pre-Professional Science Club. Dr. Holm, we're really chatting here before we got started here, but I want you to answer a question for me.
Sure.
We've all heard the joke about an old football injury.
Yeah.
How many patients do you see, or what percentage of your patients are nursing some kind of old sports injury that didn't heal up or is still causing problems?
Tons. I mean, I don't know what percentage. I mean, I deal with a lot of older guys.
Okay.
Guys have a lot of old injuries. Farmer ranchers have farmer rancher injuries more than that because they didn't play
Oh yeah,
football.
they couldn't.
They were working with dad. You know, they were out on the farm. But I have tons of people the kids who played football and basketball and soccer. I mean, there's a lot of injuries that that people and they're elderly and their knee is bad and it's a consequence of an old injury.
So we're going to have some information for them tonight.
That's it. Perfect.
Okay.
And I want to thank the Pre-Professional Club for being here and answering those phones. I talked with them last night. They asked me over to kind of say, what's it like to go through all of this? And it was a fun little chat. And we appreciate them and those who come and answer the phones for us. Well, I'm pleased to introduce our guest for this evening, Dr. Jonathan Blake from Core Orthopedics, Avera Medical Group in Sioux Falls, and Dr. Judith Peterson from Sodak Rehab, also from Sioux Falls. Thank you both for joining us.
Thank you. Thank you, Rick. Thank you, Tammy.
John, John, you're an orthopedist, a general orthopedist. Tell us a little bit about where you're from and where you trained and what got you here.
Well, my background and formative years were mostly in Missouri, in Kansas City, and went to college at a state school, much like this school, and then went to medical school in Kansas City, did my training at the Children's Hospital there, as well as some training in Las Vegas on trauma. Okay. Ended up in South Dakota because my dad's from West River area and been coming up here my whole life, and the people are great, so it's been a nice run here.
And you do a fair amount of sports injury. I mean, well, as a generalist, I mean, you deal with a lot of injury. What would you say percentage of what you do related to athletic injury?
Oh, tons. You know, as a percent, like you said, it's hard to put a percent on how the amount, but I'd say at least 50% is either acute or related. You know, a lot of people say, I did it years ago and I never took care of it, which isn't a good thing either, but, you know, you hear that a lot.
Right. Now, Judith, you're not an orthopedic surgeon, you're a physiatrist, which is a funny name, but what does a physiatrist MD do?
Well, you know, physiatrists are rehab medicine physicians, and we deal with a lot of musculoskeletal issues, which is a fancy way of saying bone and muscle problems and joint problems. And so, since rehab doctors are doctors of function, we end up seeing a lot of people with sports injuries and things like that.
And you take the patient that John does the surgery on, and you rehab them back to the real world.
And you know, even more than that, we're trying to prevent the injury. So if we see an imbalance, we try to give that athlete a program so the injury is prevented, because the best thing is that you don't need the rehab after the injury.
And you're also the physician, the sports physician for the roller dolls?
The roller dolls, yes.
Now, who are the roller dolls?
The
Judith?
roller dolls is South Dakota Roller Derby. It's Sioux Falls team. And to let everybody know, we have a bout tomorrow, actually Saturday, excuse me, at the Sioux Falls Arena for the Girl Scouts.
So you're raising money for the Girl Scouts,
Raising
Saturday
money for the
night
Girl
roller
Scouts.
dolls. It would be great to go to that thing.
Support your local roller doll.
But you were also the sports physician, the team physician for the Pennsylvania Ballet, the one with the Black Swan, who did the Black Swan movie.
That is correct. I, for years and years when I was in Philadelphia, was with Pennsylvania Ballet, treating dancers at all stages of their career, pre-professional and conservatory-trained dancers and professional dancers. And actually it was Pennsylvania Ballet that was in the background for Black Swan.
Black Swan, that's really neat. And you've just come out with a book. I mean, is the book printed yet? I mean, you've just finished writing it, right? And this is on ballet medicine?
Correct. The book is on dance medicine, and the book is available now on Amazon as well as Barnes & Noble.
And there's nothing like it.
Well, you know, we wanted something that would be for the dancer, so that if you are dancing and you want to read about nutrition, or you want to read about what are common injuries that can happen to you, this was a resource for the dancer. And so it's being published by Dance Horizons Press, and it is on sale now on the websites.
And they came to you and said, would you write this book?
Well, you know, it was such a cool project because, you know, it's illustrated by a Sioux Falls illustrator. It's a South Dakota project, so I view it for dancers of South Dakota, dancers of our region, and you know, across the country as a resource for the dancers. So it's very, very cool.
So we can talk about dance, but we can talk about football. We can talk about roller dolls.
And we should talk about roller dolls.
We should talk about from dancing to roller dolls, orthopedic questions of all types. This is sports medicine at your best. Give us your calls. We'll talk about it right after this.
A sprain is a stretch or tear of a ligament, the band of connective tissue that joins the end of one bone with another.
What lessons about exercise and injury avoidance can an everyday South Dakotan learn from an elite athlete? You're about to find out in our first story. On Call interviewed a physical therapist and a New York-trained ballerina to learn about staying healthy while staying committed to a very demanding sport. Madeline Scott is 15 years old and already an accomplished ballerina. The fact that ballet crosses the boundary between high art and demanding sport becomes evident when she explains the amount of training required to perform at her current level.
I practice between 8 and 12 hours a day. Well, right now I'm training in New York City under a professional, one of the world's most famous ballerinas, Kelsey Kirkland. And I moved there after I went to a school in Philadelphia for 2 years. I went there when I had just turned 13. It's taken a lot of training and extra activities to get me to that point.
Key to Madeline Scott's success in the competitive world of dance is her mother, Ruth Scott, who just happens to be a physical therapist with special training in dance medicine and a master's degree in sports science.
Dance medicine requires the physical therapist to understand the extremes of range of motion that the dancer goes through It's far different than other athletes. And they also, to stabilize their joints in those extremes of range of motion, need extraordinary strength. It requires a lot of strength. In the 70s, they did a study on a world-famous dancer, comparing him to athletes from the NFL, and he beat them in every aspect. Strength, cardiovascular endurance, vertical jump, everything. So it does require an immense amount of strength.
Schooling for dance requires both strength training and learning choreography. It is the first of these two elements, exercises aimed at strengthening core body muscles, that translates into a useful activity for all types of athletes.
The great thing about dance medicine is it really looks at alignment and doing things exactly right so that it's aesthetically pleasing, but also so that the athlete isn't injured, because they do far more hours than other athletes. So from dance medicine, we're able to really take that information and apply it to other sports. I work with a lot of basketball players, volleyball players.
Madeline Scott has performed on numerous ballet stages, and she knows that this kind of athletic success requires attention to all aspects of the human body.
It takes a lot of work. You have to really pay attention to your nutrition, make sure that you're getting enough vitamins and calcium in your diet, and make sure you avoid caffeine because that can really dehydrate you. I also try to get enough rest. Sleeping 8 hours a night, I usually feel my best.
But whether an athlete is performing at an elite level or just hammering it out on the local sports team, as a physical therapist, Ruth Scott has the following advice.
I'd like them to know that they really need to have an accurate assessment to know what their baseline is, and to have an appropriate program started with an exercise specialist so that they don't fail right off the bat.
Doctors, one thing I'd like to bring up is a comment by Ruth Scott. She said that the one thing dancers know how to do for sure is to jump and land, and that landing properly helps them avoid many injuries. And we all know that, you know, you've heard about basketball players and volleyball players. They landed on their knee wrong, landed on something wrong, got injured. So are we training correctly? Or?
You know, what can we learn from the ballet dancers about landing?
Well, you know, I think that it speaks to several things. It speaks to the fact that flexibility and strength matters. And it speaks to the fact that, you know, when you're trained over and over and over again to do an activity, you get good at it. One of the things that we should probably talk about when you talk about landing correctly is women are at higher risk of an anterior cruciate ligament injury of the knee.
Okay, big words, big words.
I'm going to make it simple.
Yeah.
Women are at risk for tearing a structure inside their knee, and they can have a less stable knee after it and have a higher risk of arthritis.
And women are more at risk for this than men?
Correct.
Because they have the smaller, it's not as strong.
Well, you know, it's controversial as to why women are at higher risk for this, but what we know is if we train women to land in a better way from a jump, using their muscles correctly, not landing stiff-legged, not allowing the knee to get into an incorrect position, we decrease their risk. So we prolong their sports life, which would be great.
John, explain to us what that anterior cruciate ligament is and what. That's about the most common knee injury, and it's a major injury. Why does it happen in football players? It's when they hit you and your knee is planted or your foot is planted. Explain that.
Well, you know, as Dr. Peterson was talking about, women are more prone to ACL tears. Women are more prone to non-contact tears. I think you specifically asked about football, but yes, guys, typically more guys play football. They're going to have an impact and tear their ACL. But again, it you know, she's very correct. A lot of it has to do with posture and how you land. A lot of these injuries occur when people's legs are in full extension, and that means that they're straight. Their legs straight. Yeah. And so, and she did use big words. I get that too. ACL is what the public probably hears, but the women especially, for some reason, based on the mechanics and development, like to play sports stiff-legged. They just don't like to bend their leg, you know, and have that spring. Now, ballet dancers are trained. Gosh, that young lady, probably since the time she could walk, it looks like she's been doing ballet forever. The tears are very common and they're devastating. You talk about prolonging your career. There was a movie out, Friday Night Lights, that the guy, I don't know if you remember that, went back and tried to play, and you're just cringing knowing that he's going to have a problem. It's a pretty intense movie. It's a great movie to see for any footballer. But
so what can they do? I mean, aren't there exercises that you can do to strengthen the knee and teach kids to prevent ACL injuries? The anterior cruciate is the ligament that comes across and ties the knee so it doesn't do this.
Cruciate means cross.
Yeah.
And so if you just take your fingers, put it like this, the anterior one's in front and the posterior one is in back. But based on the mechanics of your knee, the ACL tears way more frequently than the PCL.
So that the bottom goes out in front.
Yeah.
But boy, you asked a great question, which is what can we do to prevent this? And I would encourage people to, first of all, talk to your doctor about what you can do to prevent it. The Santa Monica Orthopedic Group has posted a series of exercises online to help kids and athletic trainers and physical therapists and pediatricians and orthopedists and teams prevent anterior cruciate ligament, that big word, ACL injuries of the knee, aclprevent.com.
aclprevent.com.
And it has videos of the exercises. And there's many different exercises that are available. This is one of the series. But the PEP program, there was an article about it in the New England Journal of Medicine, which is, of course, the major medical, one of the huge medical journals.
The one I read the most. I mean, it's my...
Right. It's one that many doctors read, and they show that if we could do a program like this, we could prevent even up to 80% of the injuries in the athletes. They were looking at soccer players. So that's great. So there's different programs that are out there, and people should be trying to get information about that.
But if you think about it, it isn't just the fact that kid could keep on playing if he doesn't have that injury. It means that kid doesn't grow up and come into my office when he's 40 and needs to go to Jonathan Blake and have a total knee because he's absolutely disabled from a crappy knee because he's had all that injury.
Well, right, because even if you have surgery, it's not like you flip a switch and you go back to normal.
Yeah.
You don't flip that switch once that ligament is torn.
Oh, but John's surgery, I mean, they're almost perfect, right?
Well, prevention's better than cure, but I think we should move past talking about too much about prevention because then I'm not going to have any business. Yeah. We're going to drive me out of a job. But I actually kind of think that a lot of the prevention lies on schools and lies on coaches. And they need to read up and have these exercises that are readily available part of the practice. The problem with kids in community sports is they grow up so quick. And so at a 10-year-old, 12-year-old, maybe a 12-year-old gal, but not very commonly, they're like Gumby. These kids can do whatever. And then all of a sudden their bodies start to change. Boom, you see an ACL tear, one or two. Over half of the U.S. women's national soccer team, ACL tears, and they're playing. Why is that? They could be prevented. Dr. Peterson's definitely correct in all the facts, and the New England Journal of Medicine article is dead on. But why are people tearing? Because the prevention is not, it's not.
And parenthetically, the dolls have a program in place. Because we are concerned. We want our athletes healthy.
Gee, that's funny that the dolls would have a prevention program. Where would that be?
Can't imagine.
Yeah. I'm going to switch gears here, and we're going to change topics a little bit. We have a phone call from Brookings, South Dakota, a female caller, a runner. Define what the pain is on the base of the great toe and ways to treat this pain.
Well, of course, whenever I see people who have pain at the base of the great toe, I'm going to get a uric acid level and make sure that there's no gout.
Okay, and that is not...
Gout is always seems to come to that spot. But the reason it comes to that spot more than any other spot is for two reasons. One is it's cooler and further away from everything so that crystals can crystallize, can come out of solution better where it's cooler.
And gout isn't an injury-related
problem. And that's the other reason. It's because where there's osteoarthritis and post-traumatic injury, there's a better chance for the crystallization to occur. And almost everybody has some arthritis of the big toe because how many times have you stubbed your toe in your lifetime? It's that first thing that's sticking out there in the dark and, ow, I just,
yeah.
Now, correct me.
Yeah, I think you might have stubbed your toe once.
Oh,
yeah.
No, is there any?
But John, would you?
Yeah. No, I agree. 90% of people who have gout will eventually get it in their big toe, meaning they could see it somewhere else, but it's going to end up in the big toe. Most of the time, it does start in the big toe. The other thing would be sesamoiditis. You got some bones. Sesamoid, big medical word.
Yeah.
Patella. That's a free-floating bone. Patella is the most common.
Kneecap.
Kneecap, yeah. And it floats. You can kind of grab it. But you have those types of bones in your hands, in your feet. And runners can get metatarsalgia and sesamoiditis. And you sometimes have to do some fancy scans. An x-ray may show a fracture. Those things can be troublesome and be problematic if you continue to run.
So this person is a runner, has a sore base of her first toe. I bet I know who the person is even.
Really?
And the question is, how does she deal with it? How about an injection?
Well, you know, first thing, how many miles is she running? Second question, has it recently been increased? Third question, are they new shoes or are the shoes too old? And has something about how her running stride is happening, is she hyperpronating and stressing that foot? So, you know, these are training questions, particularly if it was kind of a slow and onset thing. Because, you know, it's interesting that it's in one foot and not the other. And I agree with you about the gout question, but you do wonder, you know, what's going on there. With the shoe, with the foot.
Too short, you know, is this
right, exactly. Is this a, you know, bang, like you said, stubbing your toe, but you're stubbing your toe inside your sneaker, your running shoe.
Yeah, rotate your shoes. I think you let it. A lot of runners are running on the same shoe for too long.
If they overpronate, that's another thing about runners. Okay,
it's a word. It's a big word.
Oh, overpronation. Everybody's overpronating. You know, that means that you're turning.
But they are.
You're turning in too much, right?
You tend toward a flat foot. Your foot's going too flat. Is a pronation.
It's more common than an over-supinate. You know,
which just goes the outside. Yeah. And you can fix that with arch supports, right?
You can. See, when you're hyperpronated, when runners hyperpronated, you know, actually what happens is they get kind of a floppy foot. If your arch is too high, you get kind of a rigid foot. And if your foot's too floppy, you know, that motion has to go somewhere because you're flopping around. And it translates to your toe. Because you got that floppy foot going.
And a hyperpronator can hurt the knees too, can't they?
Well, yeah, it can cause.
Yeah, it can cause transfer lesions. You know, cause problems elsewhere in your body.
So both of you guys are into these arch supports. I mean, what do you say about
I'm not a big fan of arch supports. I think they're a pain. The problem for us as humans, and especially in the United States, is we're on the go. You know. And we're all, you know, I need this, that in my life, and I want to simplify things. So what I recommend to my patients before I go to arch supports is go to a running store, do the contact. There's some thermograms, which are these that you can step on. You can do gait analysis. You may do that. We'll send people to physicians that do gait analysis or trainers. And I'll say shoes. There's some companies that make some pretty nice shoes that you don't have to worry about the arch supports. But I think shoe wear is a big deal for people who have foot pain that are runners.
How often should you be getting new shoes?
Every 500 miles.
Well, you're quite a runner, aren't you?
Yeah.
Yeah.
I ran
today?
I ran 10.5 miles today. I'm trying to get ready for a 12 and a 13-mile run. So I had an afternoon off because I was on call yesterday. And so I got it in. Well, I'm exhausted sitting here talking to you. But it's a good feeling, and I just love it.
Yeah.
I would say this, that you should change your shoes, and there's a lot of debate about it. And I change my shoes when I look at the bottom, and it's wearing out the tread, and when it doesn't have the bounce that I like to have.
Yeah, and I think it's how many miles you're running. Because some people will keep two shoes. You know, these guys training for Ironmen and Ironwomen, you know.
Yeah. And what you're running on, too, your surface. Yeah. But what I was going to say is, orthotics are not a substitute for strengthening your foot and strengthening your ankle. Because don't forget, an orthotic is a passive device that you're putting in your shoe.
So it's like a back brace that your muscles get weaker. Is that
you want a strong foot, exactly.
So what do you do to strengthen your feet?
Well, you can do a variety of things. You can do a towel pull with your toes. You can then push the towel away. You can do the marble pickup with your foot. You can do exercises with rubber bands to strengthen your arch. There's a wide variety of different exercises that will strengthen your foot muscles.
Never heard of it.
And then it will help, of course, decrease the shock on your bones, possibly helping that toe, the toe issues.
Good. That we went on and on about that big toe, that single sore little toe.
And I have one more question. Now, if I am someone like a bit more like me, or someone
who really puts the miles out, and you're real cranking out the miles.
A real, just does a good walking shoe matter?
Yes.
It does.
I think so.
I should go actually buy a nice pair of walking shoes.
Yeah, I think it really does matter because it's shock absorption. So it's like your car. Does a really good tire matter?
Yeah, it does.
Yeah.
Okay.
Which reminds me, I need to get new tires. But what do you
After
think?
winter.
But
Now that's good time.
Now is the time. Do you agree with what she said?
You mean asking about walking shoes?
Yeah.
Oh, I think it's important to have good shoes.
Here's an interesting story. So I read an article. Of course, one article means it's an absolute truth, but they had done a number of studies on the elderly and falls. And so there is, what kind of shoes helps the person from not falling? And they found that there are 3 groups of shoes. That one is stocking feet or bare feet is one group. Another group is tennis shoes, running shoes, nice running shoes. The third was all the rest of them. And which group does the best? Where is the least falls? What's the answer?
I would guess barefoot, but here's what I suggest. I like things with wheels for people to wear roller skates and flip-flops because that gets me
business. That's what you're saying. The barefoot gives you the most business, I think, too, as well. The falls happen with the bare feet, apparently.
So
and that the tennis shoes, and it doesn't have to be an expensive pair. I mean, it can be a $22 pay less, whatever it might, whatever inexpensive tennis shoe, or even the old Keds. Remember? I mean, the canvas
Chuck
shoes.
Taylors.
Yeah.
And they look good too.
Yeah. But those are the very best for elderly.
Okay, we're going to head to the tape and then get to your questions. So here we go. When we talk about sports-related injuries, and in particular concussions, medical concerns are as much related to what we don't know about the long-term effects of these injuries as to what we do know about their long-term effects. On Call spoke with a physician who specializes in sports medicine to learn about concussion brain injuries and their impact on athletes. Dr. Craig Smith works with all types of college athletes, and from experience, he knows that a concussion injury can present itself in a variety of ways.
Everybody knows about loss of consciousness and post-traumatic amnesia, but the great majority of concussions that we see, athletes will describe them. They won't be able to say, okay, they're nauseated, they're dizzy, they may be able to say they're having headaches. Most commonly what I get is, I feel foggy, I feel cloudy.
Smith also knows that it's not just football players who are at risk for concussions. Basketball players, cheerleaders, soccer players, virtually all athletes face the risk of concussion head injuries.
With concussions, we call it mild traumatic brain injury because usually scans are negative, there's no bleeding in the brain, there's no acute findings on scans that we can tell, so it's just blow to the head.
But Smith is clear that when an athlete receives just a blow to the head, the injury can prove serious.
The facts that we absolutely know about concussions are not many, but they are these. What mechanism the injury happens at seems to affect the severity of the injury. In other words, if it's a direct on hit, whether it's from the side hit or whether it's a rotational problem with their head, when they hit, they cause different kinds of shearing forces on the brain.
Smith says that coaches, parents, and roommates can all help in identifying the signs of a concussion in an athlete.
I depend on parents if it's a high school child who know the kid. I depend on coaches at the college level that are around, or the trainers, the athletic trainers, to tell me about emotional status, where they're at with that. And all those symptoms need to be resolved at rest. Once they are, we can physically and cognitively exert them. And if they pass those tests and remain asymptomatic, we can be more confident that though they're they can have another head injury more easily, that it has less likelihood of a chance to lead to chronic problems.
Aerobic exercise is when you are continuously moving large muscle groups such as in your arms, legs, and hips for a period of time. Your heart rate increases and your breathing becomes deeper and faster.
Thank you for joining us tonight. Our show is about sports, exercise, and injuries. And here in the studio, ready to answer your questions, are Dr. Jonathan Blake, Dr. Judith Peterson, and the on-call medical editor, Dr. Rick Holm. You can call in right now with your questions about our topic. Our phone number is 1-888-DOCTOR-ON-CALL. And we've got questions to dive into. A caller from Ipswich. What factor does weight gain and bone structure have on an athletic injury? She has a grandson who's bulking up for football, and she's concerned his bone structure might not be able to handle it.
Okay.
So you've got a
John,
young...
what do you think about weightlifters and strengthening and bulking up and how about the creatine or whatever it is that they take to get more bulky? What do you think of all of that?
Well, I think a lot of it has to do with age to start with. Again, it gets back to the coaches and the trainers and the schools that if the young man is old enough, he's probably okay if he's not doing things in excess. Now, that takes somebody to be involved in watching over what these kids are doing, because sometimes they don't know limits. But if he's of age, I'd rather have them their size be because they're lifting weights and not obese, because that's another topic we could talk about too. That is a problem, but they're two totally separate issues. I think you had even mentioned, to strengthen your body, and there's different ways to answer strengthen. It does help your joints, and it'll make him a better player and make him less injury prone.
Strength is never a bad thing. I can think. Except I had one guy who was taking the power drink supplement.
Some supplement.
Creatine or whatever that is.
Yeah.
And he's really bulking up, right? And he could do more than his muscles would let him, and he tore out at one of the the ligaments.
Right. Ooh.
And so that took him down and said, don't overdo it. And that's one of those things that these supplements do. I am not in favor of those things. I'm in favor of Mother Nature will guide you. Lift those weights.
Meat and potatoes.
Meat and potatoes. Is
good diet and lifting weights.
Yeah.
Okay. Yeah. All right. I know we talked about footwear, but gentleman from Sioux Falls, what dangers are there from running around in flip-flops or flat shoes in general?
Judith.
Quick answer, flip-flops.
Well, flip-flops don't support your foot, and that flip-flop thing, just think about that with your foot and just carry that forward. And also, frankly, it doesn't protect your foot from other people dropping, for example, a 50-pound rock on your foot and things like that. So that's the flip-flops. And the shoes that don't have shock absorption can't really help you. Why not have equipment that helps you? And so that's my issue with it. Footwear really matters. It really does affect, how the shock that gets transmitted to your foot, your knee, hip, etc.
Okay.
Yeah, I want to add. This is a tangent, okay, but I really think that the spring and the cushion is an important thing, and that can occur on the bottom of the shoe. But when I was running in Atlanta, I started running when I was in med school, and I'd be coming down hills. There's a lot of hills in Atlanta. We don't have them here as much. Coming down a hill, my knees would be destroyed by the end of the run coming down the hill. And the reason that it happened is because by the time I got to the bottom of that particular stride, my foot had already straightened, and I came down on a straight knee. And so what I found I could do, and my knees wouldn't hurt, would be to come down on a bent knee, which means you have to get really low when you're running down a hill in particular. And so I've carried that further. When I'm running, I kind of look like I'm a duck running, but I don't care because I'm still running. I'm 62. I'm still running. And the point is that I come down on a bent knee, and it has spring. It's cushion. And my feet feel better. My knees feel better. My hip feels better. So I recommend, and I think it's, and there's lots of data to support it, that if you run with a bent knee, get low like Groucho Marx, that you do better. Or when you're walking, you do better. Or if you're looking to prevent an AC tear, you come down on a bent knee rather than a straightened knee.
Well, it kind of, you're talking about flip-flops. If you've ever been on a hill with flip-flops, it's not comfortable. It tears the web space between you. But I also think you got to live a little bit. I had flip-flops on when I got home. I ran home, had an hour, say hi before I came up.
Put on your flip-flops.
It just felt good. But in general, you don't protect your foot. And if you ever go to anywhere warm, because it's a little cold up here in South Dakota in the winter.
Flip-flop.
Yeah, you know, flip-flops should be in your bag, and with the TSA and what they charge, they're easy to pack.
Yeah.
So there's some advantage to having flip-flops.
So you save the flip-flop
so people don't just throw them out, because I know you're all going to throw them in the trash, but stop. You know, take them out of the trash. You can still.
But you know, actually, when you look at the shoe that Maddie Scott was wearing, in the video,
yes.
you realize that's a very different athletic shoe than a running shoe.
Yes.
It's a very different athletic shoe
yes.
than, you know, a hiking boot. And so what I would say is whatever your sport is, the footwear has to be appropriate to the sport, because otherwise you incur injury.
Yeah, good answer.
All right, a question from Sioux Falls. The lady, you may have to help me out with this. She tore the truncator band in her hip and wants to know if she will be able to walk normal again or if she needs a brace. I'm not.
What band in the hip?
I'm not sure if I.
I don't know what it is.
Probably really a tibial band, I would think.
Tibial band. Probably.
Yeah, it's either IT band or trochanter. You know, some with trochanter. You know, she could have trochanteric bursitis, but you wouldn't tear your trochanter.
I think it's a tibial.
IT band would be down by her knee.
Yeah, and that's in your thigh.
Or greater trochanter.
Explain. Let's do the IT band. Tell us about that, Judith.
Yeah.
Well, you know, the IT band is a big. You can think of it like a big strap of a big belt that goes down from your hip down to your knee.
Hip to the inside of your knee.
Right to outside.
Outside of the knee.
Outside the knee. And so, you know, it kind of rubs and it gets a big inflamed area underneath it, and it's a really common source of pain for athletes. But, you know, typically the injury of an iliotibial band injury settles down. It's typically not handled surgically the vast majority of the time.
Okay. I think this is one word, a little off topic, but it's back to gout. Can you get gout in your wrist?
Yes. You can get gout anywhere. You can have back pain with gout. You can have gout in every joint. But eventually, if you're having gout and it's a recurring problem, it's eventually 80% of the time will land on your big toe. Yeah. But it can hit any joint. The crystals come out of solution, and it can be very painful.
I want to get back to our topic, but blood test for gout, how do you determine gout?
Uric acid level.
Okay.
But still, it can be low. I mean, it's a tough topic because it can be low. It's the change, the uric acid that matters.
And as surgeons are drawing fluid, and we'll send that off too, so that you'll, you know, Dr. Holm will grab, you know, a uric acid level, and we'll grab fluid out when it gets to that point.
Your crystal.
Okay, question probably for you, Dr. Blake. Caller from Del Rapids, can you fix a torn ligament without surgery?
Well, can you heal a torn ligament without surgery? That's nice. Nice thing about being a living object. You know, people and animals and plants can heal. It depends. It depends on where it's at. Is the bottom line, and specifically, you have to look at each individual scenario and decide.
What would be a scenario where it could be healed?
When it's a partial tear, maybe, and then you let them rehabilitate and you strengthen the muscles around. I mean, correct me if I'm wrong.
Yeah, and I don't know, you know, how savvy the caller is. You know, a lot of times they confuse ligaments and tendons. They're very close, but ligaments don't heal as well as tendons, but partial tendon tears will heal. It depends on, you know, the extent of a ligament tear. A partial ligament tear you can just leave alone.
Okay.
But if it gets too far, you know, and I think even in the segment about concussions, you know, repeated. And I think you had maybe mentioned either in a segment or when we were talking before the show about you sprain an ankle and then you go out and you don't let it heal. Gosh, you know, let things heal up and stay away from doctors. Stay away from us. You know, take care of your bodies. Pain, you should back off.
Okay, you guys.
Judith, do you have any comment about the
ligament tear?
Yes.
Yeah, I think that you know, the ankle sprain is a really good example because boy, this is a common injury that people get, and people can absolutely tear that ligament.
Well, let's back up. Difference between sprains and strains and ligaments and tendons. To school us in some of that basics.
Yeah, sure. I mean, basically, when we think about, you know, let's just talk about the ankle for a second. You have a bunch of muscles on the outside, typically, of your leg that go down to your ankle, and people know where that is. And somebody stumbles, and that foot twists. And then the doctor says, gosh, you've torn the ligament. And so the patient's first question is, you know, how am I going to get around, and is that going to heal without surgery? And typically, you may, with a severe sprain of your ankle, which would be an injury to the ligament. You might even have torn it, but if you adequately rehab it, you can heal it. But then, as he said, we have the ligaments in the knee, the anterior cruciate ligament in the knee, and that is connecting, again, a bone to a bone inside, and those are harder to heal. So it's very, very dependent upon where it is. Typically, when we strain, we're straining a muscle. And when we sprain, in the broadest sense for our audience, we kind of sprain a joint, if you want to think of it that way. It's one simple way to think of it.
Okay.
And if you think about, for example, the knee, they have lateral collateral ligaments and medial collateral ligaments, which are the outside parts. So that here's your joint, and they're on the outside to keep them going this way and to keep them going this way. And then you've got your cruciate ligaments that allow the knee to bend, but it keeps it from doing this and this. So it stabilizes this joint in a marvelous design. I mean, it's just a marvelous thing. I mean, you think about the cruciate ligaments. I mean, they allow this to happen, and the ligaments don't have to stretch. And with the same way with the ankles, these ligaments, well, you tear them, and then you lose the stability of that joint.
So those are the straps that are holding the bones in the right place.
That hold the perfect.
Could I add something here? Yeah. To make it real simple for the audience, a strain involves muscle or tendon. A sprain is a ligament. A ligament attaches bone to bone. And so there are a lot of ligament discussion, but there's also tendon and muscle injuries too. About the other issue with healing, if you have a ligament that's inside a joint, they almost never heal. It's all related to blood supply, in my opinion, and doing a little bit of reading and training over the years.
A little bit of school.
But the blood supply to an ankle is much better, but you get inside the joint and the synovial fluid does not have the healing capacity to heal the injury. So around a joint, an ankle or knee, the collateral ligament is what you were just talking about. And those can heal much better than like a rotator cuff. That's a tendon tear, but it's in a joint, and so that doesn't heal very well.
So you go right now. What you do with the anterior cruciate? I mean, they've tried all sorts of artificial things,
Gore-Tex and animal grafts,
and now what are you doing? You're taking ligament from where?
You have three options nowadays. You can take a piece of the bone from the patella we talked about earlier about the sesamoid bones, but a piece of the patellar tendon, which is the big tendon right in front of your knee. You can take a piece of the hamstring, the person's own hamstring, or the third choice is from a cadaver, a human cadaver. Xenografts or animal grafts, big medical word again, but animal grafts don't work. Gore-Tex does not work. And there's a lot of research now saying that non-irradiated human donor grafts do just as well as your own tissue. Okay, there's some expense involved, but we were irradiating grafts and they were failing from other humans. So now we know that non-irradiated grafts. Well, there's people that do it. It's not. They're still doing it, but they shouldn't do it.
And the radiated, the non-irradiated, however, carry with it a little risk of infection.
Yeah, they still process them. They have these processes that all the companies tout that theirs is better. But the bottom line is you can transmit infection. In my mind, that infection, it's the mad cow disease. You want to talk about something that's really off subject, but it's those little subviral particles. You're probably not going to transmit HIV, things like that. But there are some things we don't know as doctors that we're looking for answers. But mad cow disease could be transmitted.
But there's not cases.
There's not.
But you can think about it, and it worries you.
Yeah, it does worry you, and you have to explain that to your patients. But there's great options nowadays. The bottom line is you want to have Dr. Peterson keep you away from me. If you can prevent these tears, you don't want the tear. Yeah, you do not. Yeah.
But one final comment about the tendon injuries. The more we learn about tendons and tendinitis, a lot of times, there's kind of this change within the tendon that it's not something that's necessarily so acute. So Achilles tendinitis is so common. Tendinitis at the back of the calf, runners get it, tennis players get it, etc., skiers, etc. And
tendons
it's
on the bottom of the foot.
Exactly, the back of the leg. And it's this chronic kind of injury. Can it heal? Absolutely. Is it slow to heal for a lot of people? Wow, yes.
Okay.
And it hurts sometimes.
Oh, very painful.
I was thinking of plantar fasciitis when you were saying this.
Yeah.
Let's talk about that for really quickly. How much time do we have?
Oh, we got a couple minutes.
Okay.
Quick with that, and then we'll do lightning round with the questions.
One question: plantar fasciitis. How do you treat it, John?
Well, I think it's multimodal, and I like night splints. There's some new types of injections called PRP. I think that works very well. It's controversial, not just amongst the local orthopedic community nationally, but all the studies coming out are very positive. I used it a lot in training and had great
steroid.
PRP is actually you draw blood from the person, spin it down almost to like their own stem cells, re-inject it. Works very well. I think night splints work well. Lots of stretching programs. Internet is a great place.
I've arch support, but you don't.
Well, he's right. The plasma-enriched platelet injection is very controversial, and it's used in a variety of places. As a matter of fact, there's an article in the New York Times about the writer had her hamstring tendonitis treated in this way, and I think there was a lot of commentary about that. But stretching, and then stretching.
Okay.
All right.
A question from Vermillion: can you strengthen your feet by running in the sand barefoot?
Oh, I don't have the answer to that. It hurts like all get out, and if you're not doing it regularly, I would not do it because we're used to wearing your shoes. If you're used to running bare feet, I think all this move to running like bare feet, like these people from Africa who run with bare feet and grew up running with bare feet and ran naturally. Okay, but none of us did that ever, and so unless you're running on sand a lot, I would.
And I think if you're going to use sand to strengthen your feet, you ought to do it like Dr. Peterson was talking about, picking up marbles. I think you should sit on your beach chair, maybe have a little drink in your hand, and take your toes and dig in the sand that way.
In the flip-flops that he wore after work today.
Take the flip-flops off, then you can exercise right away. Then you're ready to exercise. But running, I think it's going to lead to other problems.
I'm just not seeing this. We don't have a stable base of support.
Make sure that you
sunscreen.
All right. We have a ringer question, I think, for Dr. Peterson. Caller's daughter recently joined roller derby in Denver and wants to know the most common injury. And if you're an advocate of the sport, 30 seconds. I got for you there.
The most common injury, I'll tell you, a common injury for a lot of them is patellar tendonitis, which is basically tendonitis at the front of the knee, because they're skating bent. And so it causes huge stresses on the front of the knee.
And they're not used to it.
And you have to build up to it. That's probably one of the more common overuse injuries. And then, because derby is a contact sport, we also have more acute traumatic injuries. And those range from back injuries to knee ligament injuries are
and do you encourage it?
Do I encourage derby? I encourage derby as I encourage any sport for the athlete who's properly trained and ready with equipment that fits.
Okay.
That,
all right.
that athlete.
It's a
okay. We got to wrap things up. Dr. Blake, do you have 20, 30 seconds of wisdom you want to share with our audience?
I don't know if it's wisdom or not, but with sports, and she was talking about the most common injury, I think people need to cross-train more. They tend to overuse, do the same thing. So if they're in roller derby and they're just skating, they're going to get overuse injuries. So cross-training, pool training, biking, and elliptical training, that's very important. So
very good.
Prevention.
I think the most important thing is that everybody think of themselves as an athlete. And instead of sports medicine being for somebody playing on a football field somewhere in high school, I would think about how this attitude toward exercise can improve your health. And that's really how I would think of it. How can I make my heart healthier? How can I make my joints healthier? How can I decrease my risk of fall? And I would encourage all of our viewers to think about sports medicine in that way for their own health.
Okay. And mine is healthysd.gov. In a week or two, we're going to want you to join and do a mile a day, walk a mile a day. That's the best sport. Walking.
Okay.
Thank you both so much for joining us.
Doctor, thank you so much.
Thanks so much. Stay tuned. We will take a break and be back with the homespun perspective and then what's new in medical science.
Looking for reliable healthcare information online? You can start with the resources link at the OnCall website. From there, you can access a variety of accurate and dependable information sources, including the South Dakota State Department of Health and Medline Plus.
If you ask any of us who were on the De Smet High School football team of 1966, we'll tell you about how hard we played, the joy of our teamwork, our lasting friendships, and of course our winning record. But I have come to realize now how foolish I was to repeatedly lower my head and use it as a battering ram, hitting my opponents with everything I had. Although contact sports are so much a part of our modern life, we are finally coming to realize the danger such games can bring. Nearly 1.5 million head injuries occur in the United States each year, and 20% or more of these are sports-related. Research indicates that in football, soccer, and ice hockey, around 50% of the athletes experience some kind of concussion symptoms following a hit to the head every season. What's worse news, research has revealed that once one concussion happens, that individual is very susceptible to permanent brain injury after a second impact. Like playing on a twisted ankle, it's that second hit that does the real damage. It's a scientific fact that head trauma can result in subtle neurocognitive loss and later even chronic progressive brain disease and mental illness. One well-known example is the boxer Muhammad Ali, who struggles with Parkinson's disease, the likely consequence of repeated head trauma. So how do we protect the brains of our youth? We should start by teaching players, coaches, and parents to recognize the symptoms of concussion. If a head trauma results in headache, dizziness or imbalance, nausea or vomiting, any confusion, double vision, memory loss, sleep disturbance, emotional change, intolerance to loud noise or bright lights, or especially any hint of loss of consciousness, then there has been, by definition, a concussion. You can find more on this at cdc.gov. Any athlete with such an experience should immediately stop playing, especially in order to prevent that second impact syndrome. Medical professionals should direct any athlete who experiences a significant concussion not to return to contact play until they experience at least one completely symptom-free week. It's better to miss one game than be brain injured for a lifetime. We'll be right back.
In our medical news tonight, a type of drug that is being developed to treat Alzheimer's might also prove useful for regrowing injured nerves. This could prove incredibly valuable for individuals dealing with neuropathy. That's a condition where nerves degenerate and cause pain, and for individuals recovering from traumatic injuries like a damaged spinal cord. Researchers at Johns Hopkins in Baltimore have been studying a drug that has been in the works to combat the protein that builds up in the brains of Alzheimer's patients. Previous studies led scientists to examine how mice with damaged sciatic nerves would respond to these experimental Alzheimer's drugs. The mice were bred to have a specific genetic characteristic that made the results of the test drug more evident, and damaged muscle and nerve cells in these mice regenerated days faster than cells in ordinary mice with the same injuries. Next, the scientists took a closer look at how the Alzheimer drug affected the ordinary lab mice with nerve damage. And although the results were less pronounced than in the genetically engineered mice, they were still evident. This has researchers looking forward to more studies about whether or not this drug being developed for Alzheimer's can turn into something of real value to patients with nerve damage. And in other news, now you know if I read an article about giant fire-bellied toad brains I'd have to share, and here we go. There's a new report in the Journal of Proteome Research, for you and me just think protein research, and this report says that toad brains contain antibiotic and antiviral substances that could foster the development of new types of medication. Scientists already know that frog and toad skins contain numerous germ-fighting substances. Chinese researchers decided this was a good place to start and analyzed the brains of giant fire-bellied toads and small webbed-belled toads. small webbed bell toads. They found 59 peptides. These are protein building blocks that were completely new to science, and some of these peptides showed the ability to cripple or kill staph bacteria, E. coli, and the fungus that can cause yeast infections in humans. We'll keep you posted on that, but don't hold your breath for a show on it. Remember, On Call is rebroadcast on SDPB Digital Channel 2, Mondays at 11 a.m. Central and Wednesdays at 4 p.m. Central. Once more, I'd like to thank our guests, Dr. Jonathan Blake, Dr. Judith Peterson, and our medical editor, Dr. Rick Holm. Thanks to our phone volunteers, and thanks to you for calling in. Have a good evening.
Funding for this program is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Television.
And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding provided by Dakota Care, the Brookings Health System, Regional Health, the South Dakota American College of Physicians, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation.
To learn more about life and health, you can order your copy of The Picture of Health, a beautiful book containing insightful essays and evocative images by On-Call medical editor Dr. Rick Holm and Dr. Judith Peterson. This book, containing healthcare advice, stories of medical history, and meditations on healing, can now be yours for $17 at the South Dakota Ag Heritage Museum. Call 1-877-227-0015 to order. This offer is made by Ag Bio Communications at South Dakota State University.